Welcome to TLC Surgery. I'm Dr. Sherman Yu. I'm one of the board-certified, fellowship-trained bariatric surgeons here. We've been in practice since 2008, and we've taken care of over 20,000 patients during that time frame. We're a specialist in bariatric surgery and also in non-surgical weight loss options. Please reach out to us today for your new patient appointment. What is a new patient appointment? A new patient appointment is just us getting to know each other. We offer virtual and in-person visits. Very straightforward, simple process. It's where we really get to know some more about your medical history. We understand what you've tried before in your attempt to lose weight. And then we can talk about possibly what surgeries you've had in the past, what other medical issues you may encounter, and what we can do to help you get healthier. One of the most common questions I get asked today is, do I do weight loss medications or do I do surgery? I think a lot of that depends on your BMI, depends on your medical problems, it depends on what surgeries you've had done before. Both can work well for the patient depending on your circumstances. Medications that we talk about for weight loss are GLP-1s, medications like tirzepatide or semaglutide, which is also known as Mounjaro or Ozempic. These are once-a-week injections that can help patients lose weight. And the companies report patients losing weight in about 15 to 20% of their body weight in a year or more. Recently, there was a study done comparing surgeries to these medications. It was over 50,000 patients that were looked at. And what they found was that in the real-world setting, patients who had surgery lost 5 times more weight than patients who had medications only. And I think a lot of that has to do with, in the real world, patients end up not taking the medications as long as they want to because they have problems from it. Problems such as not wanting to do injections every week, their insurance stops covering these medications, or they're having to pay for these medications out of pocket. It ends up becoming too expensive. And so for a lot of patients, they end up not being able to maintain the medications. And when you don't take the medications continuously, you're back to square one. Your body's going to regain weight, from the weight that you lost. Versus with surgery, you're left with a permanent solution that's going to continuously give you the help that you need to help you lose weight. So if you have questions about this, what might be right for you, please reach out to us today and we can definitely get in and give you some advice. Here at TLC Surgery, we offer multiple modalities to help you reach your goals. We do non-surgical options such as weight loss medications. We offer other non-surgical options such as balloons and endoscopic procedures where we can do surgeries all through your mouth without any cuts. And then we also offer all types of surgical options, anywhere from a laparoscopic sleeve gastrectomy to advanced reconstruction surgeries and redo surgeries for patients who've already had prior surgeries as well. Another incisionless surgery that we perform is called the endoscopic sleeve gastroplasty, or some people know it as the ESG for short. What we do in that procedure is we try to mimic the stomach that's left behind after a gastric sleeve, which is a small banana-shaped stomach. So what we do is we go through the mouth and we put multiple sutures and we actually sew the stomach down and decrease the capacity to help the stomach get down to that banana-shaped stomach just like in a gastric sleeve. Surgery is done under general anesthesia. It takes about 45 minutes to an hour. And again, the key thing from this is there's no cuts, so patients can get back to recovery pretty soon and get to their weight loss goals. If any of these incisionless procedures sound like an option for you, please reach out to us today. So what's a gastric sleeve? The gastric sleeve is one of the most common bariatric surgeries performed today. There's over 200,000 of these performed a year. The surgery is done laparoscopically. You get 4 incisions about this big, with the biggest one being an inch and the other ones being about a quarter to half an inch or less. Surgery takes about 35 to 45 minutes. And after surgery, patients are up walking, getting back to normal routines in about 1 to 2 weeks. So most patients that work at a desk job can go back to work in a week or 2. The reason the surgery works so well is that 90% of your body's hunger hormone is made in the round part of your stomach. And what we do in this surgery is we actually go in and cut out that round part of your stomach so you're left with a banana-shaped stomach. So when you eat food, you're eating small 3 to 4 ounce portions from that small banana-shaped stomach. But without that hunger hormone, now we're making some metabolic changes to you. So most patients lose anywhere from 65 to 75% of their extra body weight in the first 9 months to a year. Patients do great from these procedures, and if you're doing okay, a lot of patients go home the same day after their surgery. Gastric bypass surgery. Gastric bypass is still considered, I think, by many surgeons the gold standard for bariatric surgery. It's been done in some form or fashion since the 1960s. What we do in gastric bypass is, again, this is a laparoscopic procedure. We use 4 to 5 little incisions, about this big. Surgery usually takes about an hour or so. And in gastric bypass, what we do is we cut you a small stomach, which we call the gastric pouch, which is anywhere from maybe 3 to 4 centimeters long. And then after that, we have to divide the intestine. We bring the loop of intestine up and connect it to the gastric pouch. That loop of intestine that's connected to the gastric pouch is called your roux limb. And so what that allows food to do is food passes through the pouch and into the intestine much faster. And when food gets into the intestines faster, it actually helps change some hormones in your body. So again, not only are you eating less food because of this new small stomach we made you, but we're also changing some of the hormones in your body, which helps patients lose weight. Patients can typically expect to lose about 65 to 75% of their extra body weight in the first 9 months to a year. And recovery from this procedure, just like all laparoscopic surgeries, are pretty short. After surgery, you're up walking, and if everything's going okay, you could go home the same day. Most patients take a week or 2 off of work if you're going to a desk job, and the main limitations after surgery is just no lifting more than about 20 pounds. Follow-up for these procedures, just like all bariatric procedures, are very important. And as we do our follow-ups, that's going to help prevent you from having issues long-term and keep you maintaining your goal. So what is a SATI? A SATI is a procedure that's done laparoscopically. It's an excellent procedure for weight loss. And basically, it's a modification of a procedure that's been done for over 20 years, which is called the biliopancreatic diversion with duodenal switch. What that procedure involves is basically doing a gastric sleeve, and at the end of the gastric sleeve, you divide the first part of the small intestine called the duodenum, and you bring up a loop of intestine to connect there. And so what happens at that point is you're creating a shortcut through the intestine. So food is now going through that tight gastric sleeve. And remember, you're taking out that round part of the stomach with the gastric sleeve portion of the procedure that makes your hunger hormone. And then you're bypassing about 50% or more of your small intestine, so you have less intestine to absorb over. And so that leads patients to have excellent weight loss. Patients can lose anywhere from 80% of their extra body weight or more. The downside from this procedure is patients have to be very diligent with their supplements, because when you're bypassing the intestine, you don't absorb a lot of the vitamins as well. This procedure usually takes anywhere from an hour to an hour and a half. And after surgery, if patients are doing well, they could go home the same day. Just like all laparoscopic procedures, recoveries are pretty short. Patients are going back to a desk job and go back to work in about a week or 2. And just really no lifting more than about 20 pounds for the first couple weeks. Surgery again is done laparoscopic, so typically patients get about 5 little incisions. And the key to success, just like all bariatric surgeries, you must do your long-term follow-up. And especially with this procedure where we got to monitor your vitamins long-term, that's really important. So what's a revision surgery? I get asked that by patients all the time. Revision surgery is just when we have to redo an old bariatric surgery that you already had done. Reasons to do it usually is patients are either having complications from their prior bariatric surgery, or they've either not lost enough weight or they've regained weight from it. Revision surgeries are fairly common these days, and especially for us, we've been doing bariatric surgery for over 15 years, that we've seen a lot of patients come through our doors who've had surgery from literally all over the world. And we've seen a wide range of different surgeries that we've had to revise to something to either help them having bad reflux or having swallowing issues, to where patients have either not lost much weight initially or they've regained weight. And depending on the surgery that you've had before, we can a lot of times find revision options. Revision options can be anything from an endoscopic procedure, where you go back in through the mouth to try to tighten something up by sewing it on the inside, to where we may have to go back in laparoscopically to recut or reroute something to add in malabsorption to a procedure, or to increase the malabsorption to help patients lose more weight, or to decrease the size of a pouch or a stomach to help them increase their restriction again. Reach out to us because we've done lots of revisions and we're here to help you. We see a lot of patients who've had gastric bypass in the past, and they come in regaining weight, having some problems, they need a revision surgery. One of the most common revision surgeries we've been doing is a procedure called the TORE, T-O-R-E, transoral outlet reduction. And what that means is we actually go in through the mouth and we're actually sewing up the connection between their gastric pouch and their intestine to make that opening smaller to help increase their restriction. And a lot of times if their gastric pouch or their little stomach that they've had has gotten bigger, we're actually sewing that up too and making that smaller. So those two things combined can definitely help patients regain restriction and help them lose weight again. We've seen good results. The procedure is all done through the mouth, so there's no cuts. And recovery is pretty short from this. Patients, if they're doing well, can go back to work in the next day or two after it. And so if you've had an old gastric bypass and you're having weight regain, or you're not seeing the weight loss that you want, please reach out to us. Please stick around for the Q&A. If you have any questions or want to learn more about anything, please leave a message in the chat and we'll answer them in the order that we get them. And otherwise, if you don't have time, please reach back out to us. We'd love to get you started on your weight loss journey.